Well, my mom first was diagnosed with cancer when I was a toddler, but I remember her telling me that she had cancer. And then she had a couple different types of breast cancer throughout her life and ultimately lost her life to breast cancer. So my family's lived with cancer in our lives for pretty much my whole life. Being from Lincoln and living that for the last 45 years and watching how that's treated, handled, and what's available to support people with cancer, it's important to our family.
She enjoyed life, everything. Didn't matter if we were outdoors hunting, if it was a cold winter day inside having a cup of coffee and just chatting. She enjoyed every day she was alive.
You know, we've been thinking about this project for 9 or 10 years, and we've been working to put this all together. But what Bryan does is reflect what the community needs, and the community has really stepped forward and said, we want this to happen. And nothing could be more evident than that, than a gift of 30 acres to Bryan at this time.
April and I drove out here probably 20 years ago, and we pretty much picked this location, and this quarter section was the first one available. It was her vision and my vision that we would want to stay in this part of the town, so we could formulate the right use of the ground, and certainly this is the right use of this land.
One of the things that we really have loved about this particular site is the healing environment that it presents to us. Cancer is not something that happens just once, one treatment and you're done, but this goes on typically for quite some time. And you want to go to a place that's a destination that has been redesigned in a way that makes you feel like you're in a most positive healing environment you can have.
If you are feeling good about yourself, you're feeling good about what you're seeing, if you're feeling good about the environment that you're in, there's a lot that goes with the mind-body connection. A lot that I don't think we fully understand in any discipline. But if somebody's mindset is one of positivity, they tend to do better than if they are not in that type of mindset.
Yeah, I think people in the region really deserve a leading-edge, progressive cancer center, one that really is focused and designed around the patient.
Lincoln's medical community is very unique. The physicians here, in general, I would say all know each other. However, care can still be fragmented. So one of the things that we're hoping to accomplish with this cancer center is to centralize that care, bring all of these specialists together under one roof. That does nothing but improve the patient experience.
The reason we chose this location is it's just such a beautiful location just in itself, the environment around us, but more so as we see where Lincoln's growing, and we've looked where Lincoln's growing, where is the surrounding community going? This is going to be right smack dab in the middle of it. This is going to be a place with the beltway coming in where all of those folks will be able to get to us as quickly as can be. From the north part of Lincoln to central location to all around the state, this will be a very convenient place for them.
Patients coming to a multidisciplinary cancer center will help them to not have to worry about being at this place at this time on this date, but yet having another appointment in another place and trying to manage all of those various appointments that they have when they have to travel throughout the city, throughout the country, throughout the state to do all of that. Plus, with an all-encompassing cancer center, not only will they get their treatment there, but their supportive services. So if they need to see a nutritionist, they'll be there. If they need to see a physical therapist, an occupational therapist, there's going to be a survivorship program there to help them even after they have gone through their treatment to figure out, now what do I do? How do I get myself back to my new sense of normal and move on with my life?
If we're going to have a leading progressive cancer center, comprehensive community cancer center, that can only be done with the partnership of a number of really great physicians. And we're very fortunate to have in partnership and development with us oncologists and radiation oncologists and hematologists that have stepped right up and said, we have the same vision that you have.
From a physician standpoint, it's just exciting. We're going to have research, we're going to have treatment on site, we'll have colleagues to collaborate on site. And I think as it opens and it grows and matures, it's just going to build. And there'll be even more subspecialists there to elevate the level of cancer care within Lincoln.
I think this center is going to do incredible things as far as recruiting new talent in the healthcare field to this community. This center is going to help demonstrate our commitment to providing state-of-the-art care for our patients. It's going to prove that the physicians in town are willing to come together and collaborate to do the absolute best thing for our patients.
To address the journey of healthcare, particularly when you have cancer, is a very soul-searching item. Getting this care under one roof is going to be so huge that generations to come will expect it as an everyday thing, where those of us families, and every family in Lincoln's been affected by it, have had to deal with fragmented care, not by any fault of any doctors or medical group, just that's the reality we deal with. And to have the continuity of it all centralized in one spot will be so refreshing and uplifting to folks beyond their imagination today.
I think my mom would be really proud of my dad and I for the vision and working with Bryan to do this. It's a way to give back to not only Bryan, but to our community. I think she would have really appreciated that this was going to be better for everyone else that was in her shoes, because it's a tough road. It's a really tough road, and anything you can do to make the road a little less rough, she would be happy about that.